To locate the GB34, it is in the depression anterior and inferior to the head of the fibula between the peroneus longus and extensor digitorum longus muscle. So, as illustrated in the picture. This point is best located with the patient's knee flexed. Use knee support. Palpate for the head of the fibula on the lateral aspect of the leg and hold it with the index and middle finger in a tweezer-like way. Gliding distally with both fingers, the more medial finger will drop into a depression directly anterior and inferior to the head of the fibula. The location of GB30, that is the location of the GB34. Located on the same level, but on the medial aspect of the lower leg is spleen 9. At the junction of the shaft and the medial condyle of the tibia. For needling, 1 to 1.5 June, vertical insertion between the tibia and fibula towards the interosseous membrane. Caution for the deep peroneal nerve with deep needling, in some cases also common peroneal nerve. The needle may reach the interosseous membrane as well as the epineural tissue of the peroneal nerve. For actions and indication, bladder GB34 benefits the tendons and joints, opens the channel, alleviates pain, benefits the lateral costal region, clears damp heat from the liver and gallbladder, spreads liver qi. For special features, GB34 is the HESI point, earth point, meeting point of the tendons for coordination and movement. It is also the lower HESI point of the gallbladder, Madanyang heavenly star point, major point for disorders of tendons and musculature. GB34 is one of the major points of the body. First of all, it is an extremely important point to promote the smooth flow of liver qi. It is used whenever there is stagnation of liver qi, especially in hypochondrial area. When combined with other points, it can also affect stagnation of liver qi in other areas, such as the epigastrium combined with REN12 or the lower abdomen combined with REN6. By regulating liver qi, it helps to make stomach qi descends and can be used for such symptoms of ascending stomach qi as nausea and vomiting. GB34 resolves damp heat in the liver and gallbladder, usually combined with GB24. It is an important point to relax the sinews whenever there are contraction of the muscles, cramps, or spasm. As its indications show, it affects the sinews of all joints. GB34 is an important point in the treatment of painful obstruction syndrome, atrophy syndrome, and sequelae of windstroke to invigorate the circulation of qi and blood in the legs and relax the tendons. This action is partly due to its being the gathering point for sinews. For the summary of function, GB34 promotes the smooth flow of liver qi, hypochondrial, epigastric, and abdominal distension, irritability, moodiness, depression, and sighing. It also resolves damp heat in the liver and gallbladder for the bitter taste, hypochondrial fullness, inability to digest fat, feeling heaviness. Also benefits the sinews like contracture of sinews, stiff neck, and shoulder pain in the elbow, hip pain, sciatica. It also removes obstruction from the channel, like pain in the calf muscles, painful obstruction syndrome, like the B syndrome, and atrophy syndrome of the lower leg, swelling, pain, and redness of the knee, rigidity of the knee, cold painful obstruction syndrome of the knee. According to the essential questions, the knees are the residence of the sinews. When the knees are unable to flex and extend and walk, and walking is achieved with a hunchback and the help of a cane, then the sinews are exhausted. GB34 located just inferior to the knee joint is the meeting point of the sinews and has long been considered the main point to influence these tissues. Throughout the body, for example, the great compendium of acupuncture and moxibustion simply states for disease of the sinews, select GB34. The gallbladder is interiorly exteriorly related with the liver, which dominates and nourishes the sinews, and GB34. The HESI point of the gallbladder channel is an essential point for contraction of the sinews and stiffness and tightness of the muscles and joints, and most especially for disorders of the legs such as the knee pain, hip pain, sciatica, hemiplegia, atrophy disorder, and painful obstruction. The importance of GB34 in disorders of the lower leg as a whole is further emphasized by its inclusion in Madan Young's 11 heavenly star points. This grouping of the most vital acupuncture points. According to this great physician of the Jin dynasty, GB34 was indicated for swelling and numbness of the knee, cold, painful obstruction, hemiplegia, and inability to raise the leg. The action of GB34 is not confined to the lower limb. However, it may be used in the treatment of stiffness of the neck and shoulder and pain of the sinews in the elbow, like, for example, tennis elbow. In summary, GB34 may be used for pain, cramping, contraction, stiffness, and sprain of the sinews and muscles in any part of the body. It is a characteristic of the channel, especially the young channel, that points located at the extremities tend to influence most strongly the extreme opposite end of the channel, that is the head region, while points located towards the elbow or knee tend to have their strongest influence on the middle region of the body. GB34 clearly demonstrates this principle and is essential point to treat all disorders of the lateral costal region, whether due to stagnation of qi, stasis of blood, accumulation of damp heat, or deficiency of blood or yin. This is reflected in the unequivocal statement in the Song of Points for the Miscellaneous Disease, which says pain of the lateral costal region, you only need GB34, and the Odd of Essentials of Understanding, which says when there is pain on the lateral costal region and of the ribs, needling GB34 will alleviate the pain promptly. The special affinity of GB34 for the lateral costal region reflects both the course of the gallbladder channel, which traverses this area, and its action of spreading liver qi and clearing liver and gallbladder damp heat, and thus treating two of the main patterns in distension and pain of this region. GB34 is the HESI point of the gallbladder channel. According to the spiritual pivot, HESI point treat the internal poo. The primary disharmony of the gallbladder is accumulation of damp heat, which may arise from failure of the spleen, transportation, and transformation of function, leading to accumulation of either dampness or damp heat, which obstruct the function of the liver and gallbladder. Also, overconsumption of rich, greasy food or alcohol, and attack of external pathogenic damp heat or stagnation of liver qi, which both obstructs the movement of fluids and transforms into heat, giving rise to damp heat. Whenever the etiology GB34 can be used to manifesting with symptoms such as bitter taste in the mouth, nausea, vomiting, jaundice, colitis, cystitis, etc. Another reflection of the influence of GB34 on the food is its application in the treatment of constipation, particularly when due to qi stagnation or heat. According to both the spiritual pivot and the essential questions, Taiyang is the opening, Yangmin is the closing, and Shaoyang is the pivot. In the differentiation of fevers expounded in the treatise of injury by cold, the Shaoyang level is the pivot between the interior and exterior, and Shaoyang pattern occurs when the pathogenic factor is trapped between these two levels. The characteristic symptoms of this half interior, half exterior pattern are distinct phases of fever alternating with chills, fever, bitter taste in the mouth, pain on the lateral costal region, dryness of the mouth and throat, nausea, and vomiting. GB34, the HESI point of the foot Shaoyang channel, is one of the main points to treat this pattern and is therefore indicated for any disorder with this presentation, including malaria. According to achieving longevity by guarding the source, the 7th century classic by Gang Tingxin, susceptibility to fright, timidity in which the patient fears being apprehended, all results from deficiency of qi of heart and gallbladder. GB34 is indicated for fear of people as if about to be apprehended, and frequent sighing reflecting a pattern of gallbladder qi deficiency. Finally, the spiritual pivot says, in disorders of the stomach and in disorders resulting from irregular eating and drinking, select the HESI point. GB34 is indicated in cases where qi stagnation generates phlegm and heat, which obstructs the stomach and impairs its descending function. This combined pattern of gallbladder and stomach disharmony manifests with such symptoms as bitter taste in the mouth, nausea, and vomiting. Thank you for your attention.